صباح الخير. Good morning, everyone. Buenos dias, buen dia, bon dia. Thank you for coming for day 2 of WISH. I'm here. My name is Mahmoud Lashi from WISH. I'm the head of innovation. Yesterday, we spoke to 4 of our startups. Great talk. Today, we have another 4 promising healthcare startups, and we're going to have some quick conversation for the next 10 minutes before we start our opening ceremony and the keynote speak. So first, we have Chris from Mimosa. Chris is using digital technologies like camera imaging and AI to detect the health of our skin. So, Chris, first, can you tell us about how the technology works and why it's important?
Thank you, Mahmoud. So Chris Boodoo, Head of Clinical Affairs at Mimosa Diagnostics. And we at Mimosa aim to revolutionize the way we treat skin injuries and deliver healthcare. We've taken traditionally what are large medical imaging devices that exist in the basement of hospitals and miniaturized it to a portable device that pairs with a smartphone, enabling access and removing all geographical barriers to this access to care. We believe that we should be bringing the technology to the patients who need it the most, rather than bringing the patients to the clinic or the hospital. We do this by using something called near-infrared spectroscopy, which is pretty much LED lights that illuminate the skin that penetrates at different lengths and depths. And based off the reflectance, we can detect novel biomarkers that are predictive of clinical outcome. This is important in individuals who suffer from peripheral vascular disease, diabetes, or in intensive care. We solve the problem of early detection and prevention in skin injuries.
Great, thank you very much. Next, we have Yashar from Smiletronics. He's working on, I'll let you talk about it, but first let me say, we brush our teeth every day. So his technology, Smiletronics, sees stuff that we cannot see. So can you tell us more about this?
Yep, thank you, Mahmoud. Our technology allows you to check your teeth with your mobile phone, and we use AI to give you a health report and a hygiene report. We detect the typical dental problems: tooth decay, gum disease, gum recession, erosion if you're grinding your teeth. We can even see the plaque on your teeth to be able to tell you how well you brush your teeth. Now, this is critical because we all have a mouth. It's the gateway to the body, and oral health is key to good long-term health, wellness, and quality of life. I hope you all brush your teeth every day, but you don't actually know what's going on in that until you visit a dentist, maybe once a year, maybe when you feel pain. And that's the issue in the dental care health space. It's very reactive instead of preventive. And we're in crisis. People don't know this. We're talking about health and disease here. Tooth decay, cavities, is the #1 untreated chronic disease globally. And gum disease is number 6. It's a huge, huge issue, and it can be prevented. And access to care is low in both developing and developed countries. So what we're doing is we're democratizing dental care, putting it in your palm of your hand so you can check your own dental health and your family's dental health from the comfort of your own home. Get actionable feedback around your teeth. We give you a score for trackability, so you can work to improve that, and then take action if there is a problem. Ideally, you go at an earlier stage because you're checking regularly, and therefore it's cheaper to treat, it's less painful, and this improves access to care. And overall, we want to give you all a better and healthier smile. So that's what we're trying to do.
Thank you very much. Next, we have Noel from with Vivan, the startups. So it's a bit interesting because fruit fly, cancer treatment, it's new to me. So can you just explain the system, what's going on with Vivan?
Okay. Good morning, everyone. Buenos días. Thanks a lot, Mahmoud. So, yes, the answer to why and how we can use fruit flies to develop very personalized treatment for people with cancer could be very, very, very long. So I will try to make it very short and wrap up in 1 minute. So basically, we found out a long time ago that we can manipulate the genome of fruit flies in such a way that we can create tumors in the fruit flies. And not any type of tumor, but tumor with the same features of an individual person. And then we found out that fruit flies respond to the same drugs as humans respond to the same drugs. So it was just a matter to put different pieces together, and the idea appeared to use fruit flies in where we put the tumor of an individual person in that fly, and we do chemotherapy in the flies on behalf of the patient. And these fruit flies are very tiny animal, and they reproduce very fast. So in a short period of time, we can create hundreds of thousands of these fruit flies. We call them avatars because they have the same of the patient. So we start with 500,000 of these avatars for every person, and we can test thousands and hundreds of different combinations of drugs until we identify that specific combination that is most efficient and most suited to treat the tumor of that person. It's very personalized.
That's good. And I heard something called Flybrary.
Flybrary, yeah.
What is that?
We are building a Flybrary, which is basically a library of flies. So as we build more and more fly avatars, each one of them represent a different cancer signature. That means different cancer genes in each of these flies. And as we have this large library, we can use this library to test investigational drugs for pharmaceutical companies, for instance, to find out which are the best drugs out there right now.
Thank you very much. Last but not least, we have John with Raditech. Wish is usually an enabler for some sensitive topics, but we are in healthcare, so we have to address them. He has developed or working on an antigen kind of rapid test for STIs. So, John, can you tell us about why there is a need for a home test STI?
Sure. Thank you. It's a bit weird to talk about here, but yeah. 400 million new infections of STIs every year. That number is more than the whole population of US. And most common one, chlamydia, has 130 new infections every year. And that is about 50 times of population in here. Despite all the governments in the world fighting against STIs, the numbers are still sky high. So WHO suggests every adult should do a STI screening test every year. And I followed the suggestions and did it myself. And I stand in front of the clinic 5 times in a row and walked away. And the reason is I feel so embarrassed, so ashamed to step into it. And it takes a lot of mental fighting to get into the clinics. And finally, I did it. And with the negative results, but spent lots of money. At that time, I realized the numbers are high there because the people does not go to the test. They rather cheat themselves. They say, I don't have it, rather than confirm by the doctors and say. So Raditech developing the home test to remove the shame and the embarrassment of the human being to do the testing. And we believe that will end the STI growth and end the taboos.
Great, thank you very much, John. They will be pitching today at the spotlight stage, QDB spotlight stage at 12:30. If you want to hear their pitch and talk to them, they're going to be there. And there's more startups will be at their booth. So make sure to go and see them, guys. Thank you very much. And that's it. Enjoy the rest of the day.